Welcome to the Voice of South Coast Women, sponsored by the Bristol County Commission on the Status of Women. I'm your host, Gail from the YWCA Southeastern Massachusetts, and today's topic is women's health. So I'm going to have our guests introduce themselves to start us off.
Hi, I'm Kerry Mello. I'm the Community Benefits Manager for SouthCoast Health, which is a health system here on the South Coast that includes Charlton Memorial in Fall River, St. Luke's in New Bedford, and Toby Hospital in Wareham. And in my role, I coordinate all of our community outreach and community partnerships.
Hello, I'm Dasilva. I'm a community health worker for the YWCA.
Hi, I'm Valentina Martinez. I'm also a community health worker for the YWCA.
Hi there, I'm Cynthia Marland. I'm the Director of Media for the town of Dartmouth, and I'm also a Commissioner for the Bristol County Commission on the Status of Women. Thank you for having us, Gail.
No, thank you all for joining us to talk about women's health, which is such an important issue in our community and in our area. So what is South Coast doing in the areas of women's health, Kerry?
So we have quite a few programs that affect women's health. Women, of course, are the healthcare decision makers. We all know that. We all make the health decisions for our families. So we always keep that in mind. And, certainly some of the more obvious things like breast health, heart disease, we have a number of programs that focus just on women. And actually we work often with Anna and Valentina and other people from the community to kind of promote women's health, whether it's breast health or women and heart disease. And so we really try to focus on those kinds of things.
Okay, thank you so much. Community health work, I think that's a fairly new term that some people might not be familiar with, even though all of us around here do know what that is. Can you tell us a little bit more about what actually is a community health worker? What do you do? What is a typical day like in your world?
Okay, a community health worker is a public worker that's on the front lines of the community. We live in the community, and we also know the culture of our clients. We are anything that the person needs while going through that health issue that they're having at the time. We do education. We also help that person anything that they need, from transportation to patient navigation. Sometimes I describe my job as a temporary best friend.
Okay, that sounds great.
And when we
Good
get to the
description.
patient house, it's depending, we probably go there to help a women who have breast cancer. But we find out that she cannot drive, so she needs somebody that go pick up her medication. She also has some problem with housing, so we actually refer her to the housing development to get housing. A lot of the time, they cannot even prepare their meal because they don't have a family member that can help them. So we can mail somewhere, depending what the person needs. We're there to help them.
And I think what Anna and Valentina are talking about kind of revolves around navigation, which is a really, really important thing for patients. At our cancer center, we have people who are dedicated to patient navigation, to helping patients navigate all of those things that really impact their health that we may not think of traditionally as, health. But it's really the things that take place outside of the doctor's office that most impact people's health and certainly women's health.
Okay, so are there any statistics or any data that any of you are aware of what are the primary women's health issues in the South Coast?
Well, certainly, heart disease is the largest mortality disease with the highest mortality here on the South Coast for women and men. So focusing on women and heart disease is an important thing, and Anna and Valentina really do a great job with that, with all the great education that they provide to women. Breast cancer is something that impacts women everywhere. I think, we were speaking 1 in 8 women, correct? 1 in 8 women at some time in their life will have breast cancer. Luckily, on the South Coast, the breast cancer rate is not as high in other parts of the state. But other cancers such as lung cancer, which again impact women and men, partly because of a high smoking rate here on the South Coast, and then things like diabetes, which are sort of diseases of our lifestyle. We have a very high rate of diabetes. We have a high rate of obesity, lack of exercise, those kinds of things all impact women's health and their families' health.
And especially diabetes, exercise and healthy eating is one of the major things that we have found out. A lot of the patients that we care for, we go to their house and we help them to develop an eating plan and an exercise plans, and we can see their number come down thanks to the services that the SouthCoast provide to them.
One other, statistic that is kind of alarming one, and this impacts younger women, is a high teen pregnancy rate. And at SouthCoast, we have a program. We've actually had it for about 20 years that focuses on that. It's called RAPP, R-A-P-P-P, and hopefully I can remember all the things it stands for: Responsible Attitudes Toward Pregnancy, Planning, and Parenthood. And we actually go into the schools and do a curriculum. We work with, health teachers in the schools to educate teens on, it really involves more than just education about pregnancy. It's setting goals, kind of being focused on, I want to go to college, I want to do all these things, and, so I'm going to postpone pregnancy. But that's an issue here on the South Coast that, has impacted women's health.
So is there any other advocacy, or what issues are the Bristol County Commissions working on, or any other groups that any of you might be involved in around women's health?
Well, this isn't really my expertise, but DCTV actually did do a show with Mass in Motion, and that's Kim Ferreira, and she's done an awesome job really kind of bringing the health piece to the forefront with all these farmers markets that she's been overseeing. And they've got an interesting new program where you can actually go there with your credit card or your WIC card or senior coupons, and you can get tokens. And then you can go around and buy different things at the farmers market, so that folks, senior citizens, families, everyone is eating more healthy. More obviously organic foods. A lot of those foods actually come from Dartmouth because we have many farms here.
Right.
So that's very supportive, and it also supports obviously commerce in Dartmouth, which we certainly do celebrate. So she has a few farmers markets. Unfortunately, this being the winter time, they're actually not up and running right at this moment. They are in fact at Brooklawn Park, downtown New Bedford, and Klasky Commons. Okay. But for the winter, they do have markets at Old Rochester Regional High School, and then the other one is in Marion. Okay. So you can actually go on one of the websites, farmers markets, or
I think a good website might be, it's called the Southeastern Massachusetts Agricultural Partnership, CMAP,
Yes.
S-E-M-A-P.
yes.
Exactly.
And you can usually find all of the local farmers markets on there.
So that's good, because we can't make an excuse that we can't get, fresh produce, because there are in fact places that are still open during the winter. So that's a very good thing.
And to add to that, the United Way this year started doing, it's called a mobile food pantry, and they distribute fresh fruits and vegetables for free. We were able to supply them. We have farmers markets at the hospital for our employees and for the community as well. So all of our leftover vegetables we were able to supply to the United Way food pantry. And there's one in the south end and the north end. Again, it's kind of a seasonal sort of thing, but I think they had over 500 people take advantage of the markets that were held on a weekly basis all through the growing season. So there is opportunity, as you said, to get fresh fruits and vegetables.
So it's probably a good idea, though, to look at the website and to see what's actually open, so that you won't drive yourself crazy trying to find something. And then some of the other agencies that I've served on the board with, for instance, PACE, they have a nice food pantry, don't they? And I think they have some fresh things there. Yeah, and Bruce does an awesome job with, he's got a great staff. So there are options for healthy eating.
So that's basically a lifestyle change, which I'm sure for some people can be challenging and difficult. Whereas prevention or outreach or a screening, sometimes it's easier to understand that piece. So in your role as a community health worker or patient navigation, how would you approach that? How do you get someone to do that, to understand that it's important for them now to make these changes so that they can be healthier in the future? I know you mentioned there's a lot of cultural issues that you have to work around sometimes, or to be able to have people understand how important this is. So how do you go about doing that?
One of the programs that Kerry didn't mention, and it has helped us and our diabetic patients, is the CSA program, which is a grant from SouthCoast.
Right.
And you know a little bit more about that if you
Well,
want to.
in addition to our markets, we've tried to do a lot of things around food, as does Mass in Motion and lots of other great programs in the community. So for our diabetes patients, and again, we rely on Anna and Valentina and the other great community health workers that we work with to help us with this. We have purchased two, they call them CSAs, and it does get confusing, all of the language about agriculture. So it is basically you're purchasing a share of the farm. So we buy two full CSAs for our diabetes patients. So every week, the community health workers actually bring them out to our patients and do education with recipes. Because frankly, some of the vegetables, you know, we've never seen them before, and so we need to kind of know what they are and how to use them. And our dietitians help with that. So they deliver the vegetables right to the patients and show them how to use it. And maybe, you know, you're the ones delivering the vegetables, so maybe you can talk about people's reaction, and which has been pretty good, I think. Right?
Usually about a week before we receive the donation, they send us an email stating which vegetables it will be available that specific week. So what we do is the vegetables that we don't recognize, we Google, we look for recipes.
Thank for the internet.
Thank God for the internet. We Googled the rest, say, okay, what is this vegetable? What can we do it? How can it be used in different ways? And also, how can it be frozen if it happens to be too much? Can you, I had a lady that says, oh, can we pickle that? I had no idea how to pickle vegetables. So I had to learn how to do that and say, okay, one of the things that I didn't recognize was kohlrabi, I think that's how you pronounce it.
Kohlrabi.
I looked it up in order to teach my clients how to use that specific vegetable. Because I had no clue what that was.
It's kind of fun, and you know, I mean, vegetables can really be delicious. So,
but coming back to changing the behavior and the healthy eating part, it's so difficult because when the client come to us, it's because they already have issues. For years, they have been eating the wrong kind of food. They haven't been exercising. So when they come to us, it's because they keep going to the emergency room. So it's actually not somebody who have been diagnosed yesterday and need help to continue having a healthy life. It's somebody who actually, their diabetes have become out of control and they need us to help them. And trying to teach them how to load their car, how to load their sugar intake. Especially for me in the Spanish community, we love to eat white rice and bread. I don't know about that. So it's difficult for us to kind of trying to change them, but we're trying to do it on a way to let them know it's good to eat your cultural food, but that's not all you need to be eating all the time. You need to kind of change your way of eating now.
Right. So you bring up a good point with cultural competency in this type of work, and understanding how your culture makes you who you are and drives a lot of the decisions you make, not just with something like diabetes, which is kind of like, from what you just said, is kind of after the fact. They already have that, but I'm sure even in prevention or outreach and education with breast health or cervical health, that you've run into a lot of stereotypes, a lot of myths, a lot of barriers. And I know both of you, speak another language and do programs, in different languages. So could you talk a little bit about some of the barriers to accessing prevention services, like actually getting someone to go for, a clinical breast exam or a mammogram for the first time, and understanding, some of the things that you've heard, and maybe dispel a few of those myths?
One thing that, again, I can't say enough about the community health workers, but we've found that working with our community health workers, that has really helped in breaking down those barriers. health inequity is a huge issue, and I think understanding the things about health that may not be obvious to a physician in the office, but that are happening in the community. The community health workers have really helped us do that because they're of that community, and they're kind of that link between the clinical and the community that can really help the patient. And I'm sure Anna and Valentina have specific examples of how that's worked, but it's been a big eye-opener for our doctors and a lot of our clinical people.
One of the issues that I used to have, and once in a while I still come across that, I will come across a woman that will tell me, oh, I had a mammogram 4 years ago and everything was fine. Why do I need to go back? Is to explain that you need to have a mammogram every year. You have to learn to recognize any changes in your breast. And also pretty much let them know a mammogram does not prevent breast cancer. A mammogram is just a tool for early detection.
Right.
And teach them how to be advocate for themselves. If they go for a mammogram, and I know now with the new system they have, every little thing will show. If you go for a mammogram and the doctor come and look at you and touch you on your breast and say, oh, everything's okay, it's fine, you can go for a second opinion. You need to learn to be an advocate for yourself. And that's what we teach the women.
So how do you do that? Because I know a lot of people grew up with, whatever the doctor says or the nurse says, you just do it. You don't question. You don't research anything. Too, there's so much information, on the internet that sometimes you can. I know I've done it. You scare yourself. You think you have every symptom for things. So how do you show someone how to advocate and that it's okay, to do that?
One thing we tell, try to educate patients is, it's always a good idea to have like a set of questions because doctors today are very busy. There's, not a whole lot of time, but they do welcome questions. So just think about what you want the conversation to be. And I think it's also important to make the point that primary care, having a doctor who you have a relationship with and you've developed a relationship with, is really critical in terms of your health, because the doctor will educate you about what kinds of tests you need, and it's so much better than going to the emergency room, and you really should, and there aren't as many barriers to that now with healthcare, universal health care, and so I think that's really important.
We also we come across most of the times women telling us, oh, my deductible is so high, I cannot have that test. Just let them know that most insurance right now, there's certain tests that are not part of the deductible. So they could still have their mammogram or their pap smear and not be charged for it. So that's something that we have come across, that issue quite a bit.
Yeah.
So with the changes, I know you're mentioning, healthcare, and I think it's and the insurances, which I know can be overwhelming and confusing. For a lot of people, what's covered, what's not covered, and just navigating the system. I know SouthCoast has grown, tremendously. You have new sites, and having to, just navigate that. I have, a lot of families said, oh, I feel like I'm in Boston going to here and there, and it's not, I can't just go to X street and see my doctor, and he's right there. Or she's right there. So how do you help people with that and get to that understanding of, they don't just have to talk to an automated phone, they can speak with someone to help them?
Well, again, I think, emphasizing the importance of having that primary care physician, and we call it primary care because it's like that basic healthcare relationship. And at SouthCoast, I forget what the number is now, but we have many, primary care practices that are all through the region. That there's one in just about every neighborhood. So finding that physician, whether it's a man or a woman, to kind of develop that relationship with is really, really important.
A lot of the women that we serve, like we always mention, they too rich to be paying out of their pocket, or they not too poor to be having mass health. So they're on the bottom line, and a lot of them kind of worry about that they're going to get this huge bill, that they're going to have to start paying their rent or their mortgage in order to pay their health care. But we let them know there is a lot of programs out there that help women that can afford their medication. And if they have breast cancer, you know, they, through the Geno Love, they be able to get the services for a year. And a lot of the time, we had to end up bringing them to Boston for the services that they need.
Okay.
And we also have a department that can help people kind of, I mean, as you mentioned, the insurance world is huge and confusing too. So we have a department called the Patient Financial Services Department.
Okay.
There's one at every hospital site. There's an 800 number. You can make an appointment. They speak multiple languages, and they can kind of help you figure it out and actually go on and help you, you know, find an insurance online, because there are many more options than there used to be.
Okay.
But it is confusing.
Right. So for the basic woman that doesn't have too many health issues or any health issues, what are the preventative medical services they should be having just on an annual basis?
Well, it depends on their age group.
Right. So say someone in their 40s.
To start with, I really believe in mammograms. Know your A1C, know your cholesterol, the HDL, LDL,
Yeah.
and triglycerides. Know your numbers.
Right.
And right now, you pretty much go online and they will explain everything to you. what
Blood
it
pressure
means.
is, you know, another thing that you really, because you may not know you have hypertension, and over the long term that can be really, really damaging. So certainly knowing your numbers for heart disease, though, is really important, and just keeping track of them.
At least once a year, have some
Yeah.
set of blood work.
You know, your blood
Blood
sugar.
Because just a lot of people I've spoken with, you know, when you're a child, you know, your parent or guardian is making sure you're always going to the doctor. You know, when you're having children, if you're going to have children, you're in the GYN. Then when you're older, it seems like you go to the doctors all the time. So it seems like a lot of women in that middle age group, unless you're sick, you really don't go. You know,
And certainly,
to the
you know,
doctors
we
too
didn't
much.
mention pap smears, but those are really critical, having those on a regular basis. And it gets a little confusing because I think the recommendations change
all the time.
And
They
again,
do.
you know, I'll mention it again, but that's why you really need to talk to your doctor about it, and you know, just have that conversation and see what she or he thinks.
Well, one of the other resources that I neglected to mention, I'm on the board of the Council on Aging, and the Councils on Aging throughout New Bedford, Dartmouth, they're a great resource. They have outreach workers who would probably end up connecting you to some of these folks, but they actually do go to the house. They interpret a lot of things. They obviously have health programs during the day. The COA in Dartmouth has a great Zumba class that's like age 40 to 80 something, which is unbelievable to watch. And then they have other health programs that are ongoing there. I know that New Bedford probably has very much of the same, but you know, I'm very proud of my Council on Aging in Dartmouth. We do service some folks in New Bedford, especially in that kind of Bliss Corner neighborhood, and so that's another very good resource.
Okay, that's good.
And I think one other thing in terms of prevention that we haven't talked about is what we kind of call system and environment change. So we've been trying to do a lot of work. Basically, that's making your community a healthier place, because you want the healthy choice to be the easy choice, whether it's a place to buy fruits and vegetables like the farmers markets, or being able to walk, having sidewalks and nearby parks where you can go and take a walk. I mean, and you know, certainly having those kinds of classes available are great as well. But we've been doing a lot of work with that, and just making sure that communities have access to resources, and there are lots of them, to help kids walk to school, to help seniors be able to, you know, take advantage of a walking path or a path through a park, access to healthy fruits and vegetables, and because
I think
that's
that's
important
something
too.
That's important.
That a lot of our communities, especially Dartmouth, has been doing. We have a lot of great walking paths, and the suspension bridge, which is really fun for kids.
I've
So
tried that.
That's great.
We're working at it.
Now, is there community nurses in Dartmouth?
Yes,
Or-
yes, there
and
are.
There
Yeah.
are. And what about any surrounding towns? Do they have that anymore?
You know, I think a lot of towns do. I know
Okay.
Mattapoisett has it. I'm not sure if
Okay.
every town does,
Okay.
but
That's good to know too.
And
And I know
they
there's
did,
visiting
yeah.
nurse.
during the summer they did have exercise at the park, at Bogenwood
Yes,
Park.
free
I
exercises.
actually
Right,
attend
right,
2 of the classes,
right,
and
right,
that
right,
was really good.
right.
I think it was about 2 or 3 times
Times
a
in the
week,
summer.
and you would go during the summer in the morning, and it was free.
And
Just bring your sneakers and-
there's a new initiative in New Bedford. Before I forget, every single Sunday, it's from 11 to 3, and it's totally free. It's at the Boys and Girls Club. So there's some sort of aerobics class, Zumba, something like that.
Okay.
There's yoga. There's a nutrition class, which often includes a delicious cooking demonstration. And then there's a meditation and mindfulness, which is kind of we could probably spend a
That's a
whole
whole nother
half
topic.
hour
Yeah,
talking about
absolutely,
that, but it's very
absolutely. It's all about the
interesting.
mind.
And it's sponsored by New Bedford Well. Dr. Mike Rocha organizes it, and it's every single Sunday
From 11 to 3?
from 11 to it goes from 11 to 3. It's 4 different classes,
And
and they're free. Yep, South Coast sponsors
that.
it. A number of community.
Especially now with
the
the
Carney
winter coming,
Foundation.
you need to have some programs indoor that people
Right.
can
Yeah,
go
yeah.
and take advantage of it.
We've been doing it for a month now, and we've had quite a few people take advantage of it.
And
So
you have the
it's a
van
good-
too, the mobile
with
van.
this and the mobile van, and the mobile van actually is there once a month. But we have what we call the South Coast Health Van. So we're out every single day somewhere on the South Coast.
That's
You can
wonderful.
find the calendar on our website, southcoast.org. And we do all sorts of, a lot of the screenings we've been talking about: cholesterol, blood sugar, blood pressure, cancer education. There's nurses who staff the van. They're a smoking cessation resource. So lots of good things that you can find on the van.
Great.
The Sure Fit kit also
Yeah.
Oh, that's all great information. So
Colon
before we
cancer
wrap up,
screening.
for
are there
colon
any
cancer.
advocacy issues that maybe the Bristol County Commission is working on? I know sometimes you go around and do hearings. Have you heard anything in regards to women's health or something we should be calling our legislators about?
Well, I mean, I think that it's kind of an ongoing process. Each commissioner kind of has a niche, and this is one of the things that I'm doing is trying to kind of put the word out there. And then obviously the equal pay is on the forefront. The health is probably something that they need to watch this video that we're producing right now and see what all the resources and the great job that these gals do in the community. Because it's something we can be proud of.
Yeah, definitely. Well, it's definitely come a long way. I remember I used to be a community health worker, so coming down and going to the State House, especially when breast cancer first became more known, in the public eye, and going up for the coalition and having, more money coming down for the free screenings. That's when all of that first started, over 20 years ago, dating myself now. But it's, it has come a long way now that we have universal health care. And even though we know not everybody has health insurance, much more people do, and the services are much more, available to everyone. So it's nice to see that it does work, using your voice does work, for advocacy, efforts. So as we, get ready to wrap up, is there any final words? We'll just go down the line, and anything you want to leave our viewers with about what they should think about or know about for women's health. We'll have everyone's contact information on at the end so people can get in touch with our guests if they have specific questions about that, or if you would like a community health worker. I'm sure everybody would love that.
I know.
to bring them to the doctors and answer their questions and show them fun stuff to eat. So start with Kerry.
I guess information, I think we've all talked about that, is sort of key, and knowing where to go to find information and how to use that information to promote your health and your family's health is really important.
One of the resources that I haven't talked about it, but it's available and most insurance will cover. Sometimes when the woman has a lumpectomy, she feels self-conscious because her breasts are not even. Just letting you know that your insurance will pay for special bras, and you're entitled to have 2 per year. And we have a great store very close to us where you could go and be fitted, and most of the times it is free of charge because your insurance will cover.
Okay, good to know.
I think knowing your body, knowing yourself, knowing how to advocate for yourself. Don't take a "is okay" answer.
Okay.
Don't worry about it.
Right,
It's
right.
your health.
Right.
Go for a second
Very
opinion.
important.
And I would say just be persistent. I mean, that's the key to everything. There's all these resources that we have in the community, so get on the internet, get some information, go to some of these free classes, which is wonderful. I mean, you don't have to pay a lot of money to find places to help you, and just be persistent.
Great. Well, thank you all, our guests, for being on the show. Thank you for watching The Voice of South Coast Women. Join us next month, where our topic will be mental health. Thank you, and have a great day.